This video will review the anatomic biologic ACL primary repair with BEAR augmentation. First things first, we're going to clean up the knee and resect some of the fat pads so we can see better. And then with the beaver blade, we're going to create a proximal type 1 ACL tear. Using the self-retrieving suture passer, we're going to pass a number 2 active braid in a Bunnell type fashion back and forth in the AM bundle as we walk proximally up the ligament. It's preferable to exit at the end of your passing with a suture on either side of the AM bundle. You'll see why this is important later. Next, we're going to make an accessory inferomedial portal to park the AM bundle sutures out of, to keep them out of harm's way, and assist with suture management, as you can see here. Using, again, the self-retrieving suture passer, this is the mini fast pass. We're going to go back and forth with a second number 2 active braid in the PL bundle, this time exiting with both limbs towards the wall. At this point, we're going to switch the sutures so that the AM sutures are coming out of the standard portal and the PL are out the inframedial portal. Next, we punch and tap. As you can see here, the knee is usually in about 115 degrees of flexion. We're going to use the 4.75 Osseo suture anchor to fix the PL bundle up against the wall. You can see here that we've anchored the PL bundle. We're cutting the repair stitches, and now we're going to use the core stitches, bringing them back out the AM bundle, and we're going to sequentially pass them from lateral to medial through the PL bundle, and we'll use them later to compress the PL bundle up against the wall. You can see here as we tension them. With the knee at 90 degrees of flexions, we're going to punch and tap for the AM bundle sutures. Here you can see the 475 Osseo anchor going in, and this is really completing the repair, the dual bundle, dual anchor repair. A little bit of suture management here. We can remove the core stitches, and then we're going to keep the 2.5 active braid tape, which will later be used as our suture augmentation to hold the BEAR in place. We cut the AM bundle repair sutures short, and now we're going to tie the PL compression sutures, which were the core stitches from the PL bundle. We're going to tie them with alternating half hitches, effectively compressing the PL bundle up against the wall and improving our vector. We cut these short, and next we're on to our drill hole in the tibia. We use a standard guide, come up in the anterior third of the tibia, and we're going to use a cannulated drill pin here. Once we remove the cannulation, we can thread up our nitinol wire, which will allow us to pass the suture augmentation down through the tibia ultimately. Now, because we're doing a BEAR here, we've got a few more steps, and what you're going to see is that I'm going to switch my sutures and the wire to the inframedial portal to get them out of harm's way, and then I'm going to use a scalpel to extend my anteromedial incision, or my medial portal, so that we can ultimately insert the BEAR. Here we are retrieving the wire. Again, to get it out of harm's way, you want to make sure you keep control of that wire so you don't lose your spot. As we extend our medial portal, you can see it put a digit in, so you can see we have a nice pathway to get the BEAR in. And now we're going to retrieve the suture and the wire back out that extended portal. And we're going to get ready to pass the suture augmentation through the BEAR and then the suture augmentation down through the tibia. Here you can see we've got the BEAR. We've got a little passing suture going through, which is going to help us put our suture augmentation down through the BEAR implant. And then we'll pass the suture augmentation down through the tibia. At this point, we can take our syringe of whole blood, which we've gotten from our anesthesiologist, and we're going to just saturate the implant. We start at the top so we can soften the top a bit to bullet the nose. I usually put a little down through the hole, and as we compress it and bullet the nose, we can slip it right in there. And while I pull tension on the suture augmentation, we're going to extend the knee with some pressure with my thumb. We can push the BEAR implant right in there where it's going to sit right on top of the repaired ACL. With the knee in extension, we will now punch, tap, and place our last osseosuture anchor, fixing the suture augmentation and effectively completing the case. Thank you for your attention.